Now here, Downing Street has revealed that the Prime Minister has ordered weekly updates on admissions to the accident and emergency departments of England's hospitals. The move came alongside two new warnings of a potential crisis this winter, while the College of Emergency Medicine said that more than half the specialist registrar posts in A&E have been left vacant over the past 3 years. The NHS regulator, Monitor, reported that almost a quarter of walk-in clinics had closed over the same period, leaving patients with little out-of-hours alternative to A&E. Cordelia Lynch has this report.
Particularly with work round here in London.
NHS walk-in centres are popular. They're convenient, but they're closing, and those who work in them can't understand the logic.
It will definitely increase the pressures on GPs for those patients who are registered. For those patients who aren't registered, they need to look at other choices. So that will inversely, increase the demand on accident and emergencies, which are already, as we know in the press, overstretched.
The reasons are varied: funding, a lack of demand, and in some cases too much demand from the worried well. This centre in Soho in London is one of the country's success stories. It's run solely by nursing practitioners, and nearly everyone gets treated, sparing local GPs and hospitals. Medical professionals from across the world come here to see how they can emulate the nurse-led model. And importantly, this walk-in centre makes money. They have many foreign visitors and they charge each one £75 per consultation. What would you do if this was closed?
I'm not sure. I would probably have to go to a hospital and sit there for like hours and hours and actually have to go back to work. They're just actually calling me for the medical check, so.
I just find that it takes a bit too long to get an appointment at the doctor's, like a GP surgery, so especially being in London, it's easier to go to a walk-in clinic.
Since 2010, 53 of England's 238 walk-in centres have shut. Health regulator Monitor surveyed just under 1,900 patients at 20 walk-in centres. 21% said they would go to A&E if the walk-in centre was not an option, and 34% say they would go to their own or a different GP.
The first group is made up of people who can't get an appointment with a GP easily, or people who thought they wouldn't be able to get an appointment with a GP, so went directly to a walk-in centre. And the second group of people were those people who don't like to register with a GP. So more vulnerable people, homeless people, people with substance misuse problems, and they really value the service that they receive at a walk-in centre.
We want to see a network of centres that are open literally from 7 in the morning to 10 o'clock at night.
They were Labour's magic bullet for patient waiting times, common in poorer urban areas. The closures are fairly evenly spread from north to south, but A&E departments will struggle to pick up the slack. Today it was revealed more than half of specialist registrar posts are vacant, and with 5-year contracts due to expire next year, people are anticipating further closures.